Okay, so taking a first look at the newborn, you want to notice the position and the posture of the baby. You will most likely note the baby will be flexing here at the elbows as well as the knees and the hips. You want to look for symmetry as the baby's moving and flailing around. Checking the vital signs, you want to find the point of maximal impulse of the heart. You're going to count the heart rate for a full minute. It should be between 110 and 160 beats. You want to look at how the baby's breathing. It's normal to see the abdomen moving faster than the chest because they're a diaphragm breather. You want to count the respirations for a full minute. They should be between 30 and 60. You're going to want to listen for the breath sounds, starting in the upper lobes and moving side to side. I'm doing this a little faster, but they should be equal. You want to make sure there's no crackles or bronchi. You want to listen to the 4 quadrants for bowel sounds. As far as the skin in general, newborns, if their term, should be soft and smooth. They should normally will have deep cracks in the abdomen. Blood vessels will be faintly visible. You want to assess their skin turgor by gently pinching and letting go. It should snap back immediately, and that's normally done kind of on the abdomen area. You want to check for things like mottling, lanugo, vernix, the milia, which is the white spots around the nose and mouth, Mongolian spots, that's more in Mexican and African American babies. Those are usually spots seen above the bottom here, and you want to definitely make sure that you note those because those can be mistaken for bruises later in life. And all those things are normal findings. You want to check for jaundice by blanching over any kind of bony prominence, so the knees, for example. And you also want to take a look at the sclera. And this is an abnormal finding within the first 24 hours. It should be reported if you see the yellowish kind of color. You want to check the extremities, the hands and the feet. It's normal to see the acrocyanosis, which is that bluish color in the hands and feet for the first 24 hours. Central cyanosis, however, which is like a bluish color all over the body, is not normal. It indicates poor perfusion, and that needs to be addressed immediately. Now, as far as measuring the baby, this can be a good time to do that. You want to measure the occipital frontal circumference, which will be around the head, just above the eyebrows here, going all the way around. The chest circumference will be here, right at the nipple line, all the way around. And then the length will be from the top of the head here down to the heel. And you want to make sure that you extend the baby's leg all the way out so you get that accurate full measurement. And then breaking down the actual head to toe, starting with the head, you want to lift the head up, palpate the fontanelles and the suture lines with the index finger. Fontanelle should be soft, flat, and firm. The anterior fontanelle up here is more diamond shaped, and then the posterior is a triangular shape. You should notice that the hair will be kind of fine and silky. You also want to assess for cephalohematoma and caput. Both of these things will resolve themselves. They're kind of just their type of birthing injury, but should go away. You want to assess the facial symmetry. It's usually best to do that while the baby's crying. And moving down to the eyes, it's common to notice that for there to be a little bit of edema around the eyelids. And the iris will be usually a deep blue, and then the sclera is bluish, and this can be a good time. Check the pupillary reflexes. Okay. Moving to the ears, you want to draw kind of an imaginary line from the outer canthus to the pinna here. It should be just a straight line. Anything that's kind of higher set or lower set is more kind of abnormal. To test the hearing, you just clap loudly and they should kind of cringe at it. Moving to the nose, you want to check the symmetry of the nose. You want to check the patency of each nostril. You do that by holding one side, holding the other, and then while you do that, you want to make sure that the mouth is closed the whole time for that. Moving to the mouth itself, stroke the cheek, and that should elicit the rooting reflex. It's normally what babies do for breastfeeding. They should be moving their head towards my finger or the nipple as their stimulus. While finger is in the mouth, you want to check their sucking reflex. You want to palpate along the gum lines, the soft and the hard palates, checking the integrity. This can elicit the gag reflex. You want to look at the lips and the mucous membranes. They should be pink and moist. Moving down to the neck. In newborns, the neck is short and creased and will have skin folds. You want to palpate here, checking for swollen lymphs. You want to turn the head from side to side, checking the range of motion. You want to examine the integrity of the clavicles because it is the #1 birthing injury to have a broken clavicle. You want to evaluate breast development. It should be a 5 to 10 millimeter bud. Moving down to the abdomen. Normally you'll see newborns having a more rounded abdomen. This is normal. You're going to want to assess the umbilical cord. It should have 2 arteries and a vein. It can be tinged kind of a greenish color because of the meconium in the amniotic fluid. Palpate the abdomen in a clockwise direction. You want to start light to just feel for like the abdominal tone and if there's any masses. And then you want to do deeper palpitations to feel for like the liver, which will be about 1 to 2 centimeters below the right costal margin will be the liver border. And then if you move over to the left side, you can feel the tip of the spleen normally. You want to assess for femoral pulses, and those should be equal to the brachial pulses. Now, moving down to the genitals, we have a baby girl here. So for looking at a female newborn, you're going to check the external genitalia. Labia majora should be covering the minora and the clitoris. You want to spread the labia down here to examine the urethra and the vagina. It can be common to see white or blood-tinged discharge. Totally normal. It's from hormones. And then if you turn the baby over, examine the anus. You want to make sure it's patent, and you can confirm this by the first bowel movement. You'll know. Stroking the skin next to the rectum will stimulate the anal reflex. You want to assess the joints, specifically the hip joints, making sure knees are at equal height. If you flex the knees up, which this baby doesn't do, but if you flex them up, you want to make sure that the knees are even. If they're uneven, it means that the hips could be dislocated. You want to check the stability of the hips by using Barlow and Ortolani's test, which this baby doesn't move very well, so can't really do that on this. Then you're going to want to turn the baby over, look for symmetry of the scapula. Asymmetry could mean the fractured clavicle that I was talking about earlier. Look again at the head for signs of trauma. You want to assess the spine for visual integrity. Palpate all the way down. Ensure all vertebrae are present and that nothing is broken. Okay, you want to look at the dimple here at the base of the spine. Ensure it's closed. Look at the gluteal folds. Make sure that those are symmetrical. If those aren't symmetrical, that's another way. It could also indicate a dislocated hip. You're going to want to listen to the breath sounds again on the back this time. Like that. Okay, you want to evaluate all the reflexes now. A stepping reflex. One foot will be touching a solid flat surface, and the opposite foot should be retracting up. This one will be, the one touching the surface will extend and then retract. Okay, you want to feel the shape and outlines of the bones in each extremity. All joints should be checked for a range of motion. Do each finger, the elbows, shoulders here, hips, knees, ankles, toes. Count the number of digits on hands and toes. You want to look at the creases in the palms. While you're doing that, you check the palmar grasp reflex, which basically you're just going to stroke your finger across, and they should be kind of making a fist like that. You're going to want to check the plantar reflex, which if you're kind of putting your finger across like that, they should curl their toes as well. And then you want to check the Babinski reflex, stroking. I'll kind of turn the baby over to see it better. If you stroke from the heel to the pinky toe and across, the big toe should flex and the others will extend. You want to look at the creases on the foot. The further down they are to the heel, the more mature the baby is. And then you are going to want to, I don't really have a bed that the baby's in, but assessing the Moro reflex, you gently lift the bed that the baby's in and drop the bed. And it kind of does like a little flailing type thing. You want to assess the symmetry of the arms as the baby flails. And that's pretty much the head to toe assessment.